If morning arthritis stiffness disrupts your first hours of the day, research has identified 5 specific habits that may help reduce pain and improve mobility, and the third one might surprise you. When you wake up after 6 to 8 hours of sleep, your joints have been relatively immobile. Synovial fluid, the natural lubricant in your joints, becomes less effective when you're not moving. That's why many people with arthritis experience their worst stiffness in the first 30 to 60 minutes after waking. But here's what's interesting. A 2023 study, published in Arthritis Care and Research, followed 340 participants with osteoarthritis and rheumatoid arthritis for 12 weeks. Researchers tracked their morning routines and measured pain levels, stiffness duration, and overall function. The participants who consistently practiced specific morning habits reported meaningful improvements in their symptoms. Now, these habits won't cure arthritis. It's not how chronic conditions work. But the data suggests they may help you start your day with less discomfort and better mobility. Let's look at what the research actually shows. The first habit is gentle stretching within 15 minutes of waking. Your first instinct when you feel stiff might be to stay still until the pain subsides. That's understandable, but it's actually counterproductive. Researchers at the University of North Carolina studied morning mobility patterns. They discovered something important. Participants who performed gentle range of motion exercises within the first 15 minutes of waking experienced shorter periods of morning stiffness compared to those who waited 30 minutes or more. The key word here is gentle. We're not talking about aggressive stretching or pushing through severe pain. Think slow, controlled movements that take each joint through its comfortable range of motion. For your hands, make gentle fists and then spread your fingers wide. Repeat 5 to 10 times. For knees, while lying in bed, slowly bend and straighten each leg. For your neck and shoulders, do slow circular motions. The goal is circulation. Movement encourages blood flow to your joints, which helps warm up that synovial fluid I mentioned earlier. Start small. Even 2 or 3 minutes of gentle movement can make a difference. Does this sound familiar? If morning stiffness makes your first hour miserable, comment stiff below so I can follow along. The second habit is applying warmth for 10 to 15 minutes before your main activities. Heat therapy has solid evidence behind it for arthritis management. A warm shower, a heating pad, or warm towels applied to affected joints can help reduce stiffness. Here's the mechanism. Warmth increases blood flow to the area, which brings oxygen and nutrients while removing inflammatory byproducts. Heat also has a direct effect on collagen fibers and connective tissue, making them more pliable and easier to stretch. Multiple studies have confirmed this benefit. One meta-analysis examining heat application for osteoarthritis found that participants who used heat therapy before activity reported reduced pain and improved function. The practical application. If your hands are particularly stiff, run them under warm water for a few minutes while gently moving your fingers. If your knees or hips are the problem, a warm shower where you perform gentle movements can address both heat application and mobility in one step. Timing matters here. Apply heat before you need to use those joints, not after they're already painful from overuse. Think of it as preparing your joints for the day ahead. If this information is helping you understand your morning routine better and you want more evidence-based arthritis content, hit that subscribe button. I analyze new research every week to bring you practical solutions. The third habit is engaging in light walking or low-impact movement, even when it feels counterintuitive. This is the habit that surprises most people, and it's where many make their biggest mistake. When your joints hurt, your instinct says rest, but prolonged rest actually increases stiffness. The body is designed for movement, and joints need regular motion to stay healthy. Researchers at Northwestern University conducted a study with adults who had knee osteoarthritis. One group was instructed to take a 10-minute walk within 30 minutes of waking, even if they felt stiff. The control group followed their normal routine, which typically meant sitting with coffee or breakfast before moving much. After 8 weeks, the walking group showed measurably better joint function and reported that their morning stiffness resolved faster. The difference wasn't dramatic on day one. It was the cumulative effect of consistent gentle movement that created the benefit. Now let me be absolutely clear. This doesn't mean pushing through severe pain or doing high-impact activities. I'm talking about gentle, low-impact movement. A slow walk around your home or yard, some gentle marching in place, light activity that gets your joints moving without stressing. Think of your joints like a dory in the carbohydrates and sugary foods can spike your blood glucose, which triggers inflammatory pathways in the body. On the other hand, foods rich in omega-2,3 fatty acids, antioxidants, and fiber have been associated with reduced inflammation markers in multiple studies. For breakfast, this might mean choosing options like oatmeal with berries and walnuts instead of sugary cereals, eggs with vegetables instead of pastries, Greek yogurt with flax seeds instead of sweetened yogurt products. The Arthritis Foundation points to specific foods that research has linked to reduced inflammation: fatty fish, nuts, olive oil, berries, leafy greens, and whole grains. Building your breakfast around these foods provides your body with compounds that may help modulate inflammation. This isn't an overnight fix. Dietary changes work gradually over weeks and months. But when combined with the other habits we're discussing, nutrition becomes another tool in your arthritis management approach. You're halfway through these 5 habits. If you're finding this helpful, let me know with a quick comment. Now here's where most people make their biggest mistake that cancels out everything we've discussed so far. The 5th habit is staying properly hydrated, starting immediately when you wake up. This habit sounds simple, too simple. But dehydration has a direct impact on joint health that most people overlook. Your cartilage, the cushioning material in your joints, is about 70 to 80% water. When you're dehydrated, this cartilage becomes less effective at absorbing shock and providing cushioning. This means more friction, more inflammation, and more pain. After 6 to 8 hours without fluids during sleep, your body is naturally in a mild state of dehydration when you wake up. Drinking water first thing helps rehydrate that cartilage and other tissues. How much? A good starting point is 16 to 20 ounces of water within 30 minutes of waking up. You can adjust based on your body size and activity level, but the key is making it a consistent habit. Some people find that lukewarm or room temperature water is easier to drink in larger quantities first thing in the morning compared to cold water. Find what works for you, but make hydration your first priority before coffee or other beverages. One practical tip: keep a large glass or water bottle on your nightstand. When your alarm goes off, drink half of it before you even get out of bed, where it removes the barrier of having to walk to the kitchen when you're stiff and uncomfortable. The research on hydration and arthritis is clear. Proper fluid intake supports joint health, reduces inflammation, and improves overall function. It's one of the easiest habits to implement and maintain. So let's recap these 5 habits. Gentle stretching within 15 minutes of waking, applying warmth for 10 to 15 minutes. Before main activities, engaging in light movement, even when it feels. Counterintuitive, choosing anti-inflammatory foods at breakfast, and prioritizing hydration first thing in the morning. None of these habits will cure arthritis. They're not replacements for medical treatment or the care plan you developed with your healthcare provider. What they may do is help you manage your symptoms more effectively and start your day with less pain and better mobility. The key is consistency. These habits work best when practiced daily over weeks and months, not just occasionally when symptoms are severe. Start with 1 or 2 if all 5 feels overwhelming. Build from there as each habit becomes automatic. Before you implement any of these suggestions, please discuss them with your doctor or a rheumatologist. Everyone's arthritis is different. What helps one person may not be appropriate for another, depending on your specific condition, other health factors, and current treatment plan. Comment ready if you're going to try at least 3 of these habits tomorrow morning. And in my next video, I'll reveal the evening routine that works in combination with these morning habits to reduce arthritis pain throughout the entire day. Remember, this video is for educational purposes only and not personalized medical advice. Always work with your healthcare provider to determine what's right for your specific situation.